Can disc herniation cause pelvic floor dysfunction? The answer is it can. So now let's review this together. When it comes to disc herniation, unless there was a direct trauma that just initiated the process, you got to understand that disc herniation happens as a result of ongoing dysfunction in movement, putting undue stress on the disc to the point where it becomes herniated, protruded, or disbulged, whatever the case may be. So when it comes to that, when you understand that, you see that there is a dysfunctional patterns of movement going on, leading to, when it comes to pelvic floor dysfunction, pelvic instability. So pelvic floor dysfunction can come in many shapes and forms, but when we look at the beyond the symptoms, when we look at the cause or what is present, we see that the floor is unstable, it's weak, it's tight, whatever the case may be, as a result of the instability of the pelvis. So when we have the pelvic floor dysfunction, we have pelvic instability. When there is disc herniation, it's dysfunctional patterns of movement having led to the herniation of the disc. So they can go hand in hand. Does that mean that everyone with disc herniation has pelvic floor dysfunction? Pretty darn close. I can't say everyone because I'm sure there are exceptions, but based on the merit I just discussed with you, you can see that disc herniations happening from dysfunctional patterns of movement. Dysfunctional patterns of movement lead to pelvic instability as one of the things that they impact, and pelvic floor dysfunction can show up in the forms of many phases of pelvic floor dysfunction, which can be incontinence, it can be pelvic pain, it can be chronic back pain, chronic sacroiliac joint pain, chronic hip mobility and pain, poor posture, lower extremity issues, on and on and on. I've done blogs on this. You can find the information from the website in the description box. And so just wanted to bring that to your attention because we gotta be smarter than what we are, because we're not seeing a decrease in the number of people with issues. We're seeing an increase, and our lifestyle and everything else is just contributing as well. Hope this makes sense. Thank you for watching me here. Thank you for subscribing to the channel. And if you have any questions, use one of the methods of contact in the description box, because I'll be more than happy to see what's happening. Until next time, take care.